Good afternoon, everyone, and hope people were able to celebrate the holiday that honors our nation's heroes, as well as maybe graduations, other special events in a MSD, masked and socially distanced kind of way. I want to mention that our numbers today, the cases, the deaths, the total specimens resulted are today, as they typically are on the weekends, a little bit lower. And that's because medical providers, local health departments, laboratories may not always report everything over weekends. And we were fortunate in our state public health labs to actually give them a day off for the first time in months. So we will see the numbers pick up again after starting tomorrow. But since yesterday, we had 1,178 individuals that were diagnosed with COVID-19. That brings our statewide total of confirmed cases to 113,195. This did still include the report of 39 additional individuals who lost their battle with COVID, for a total of 4,923 deaths. As of last night, and these are actual numbers not affected by the weekend, 3,788 people were in the hospital hospitalized with were hospitalized with COVID-19, and of those 3,788, 1,035 patients were in the ICU, and 590 individuals were on ventilators. To date, 794 tests have been run, with 17,230 being reported in the last 24 hours. I see my role as one to share data and also to share ways that the public can keep themselves safe, but I'd also like to share some hope. And I do want to share that for the week ending May 16th, we reported out a total of 780 deaths. While 780 deaths, of course, represent 780 individuals who lost their lives, and families and loved ones and communities who are mourning those deaths, it still signals the first week that there have been fewer deaths than the previous week. And so I am hopeful that this fact is the beginning of a downward trend. But of course, that also depends on all of us and making sure that we're doing all that we can to decrease the transmission of this virus. Another good thing is that remdesivir, that is the investigational drug that has showed some important clinical outcomes for hospitalized patients, and that it decreases hospital stay. We did get a third shipment of remdesivir last week, and that involves 353 cases, and that has been distributed to hospitals around the state. Each of these cases has enough vials to treat approximately 5 patients, depending on the course of treatment that's utilized, whether it's a 5-day treatment or a 10-day treatment. And I know hospitals want to know how we determined where that medicine went. We looked at several criteria. We analyzed COVID-19 data provided by hospitals, the number of COVID-19 patients, as well as bed and ventilator use. Every hospital with at least one laboratory confirmed or probable COVID-19 case using a hospital bed between May 12th and 18th received at least one case. The remaining cases of remdesivir were distributed proportionally among the hospitals based on the number of confirmed or probable COVID-19 cases in their hospitals during that same time frame. Hospitals that may not need the remdesivir that they were allocated are free to share their allocation with other hospitals that can use the medicine for their COVID-19 cases. We will not be getting any shipments of remdesivir this week, but we are expecting additional shipment next week. It is our intention to make sure that every hospital that's treating COVID patients receives at least a case of remdesivir. And so if you happen to be a hospital that did not receive a case, please call the COVID line and let us know that. We will make sure that with next week's shipment that you are included. We are trying to make sure that this touches every hospital that's participating in COVID care. So while early studies have shown good results, this is still an investigational drug. We're learning that there are other drugs that are in the pipeline. This drug did show decreased hospitalization days, and so we are happy to have received this from the federal government and are happy for our hospitals to be using this in the care of COVID patients. But until we have a definitive cure and a vaccine, we must continue to protect ourselves from the virus and prevent further spread. I thank Governor Pritzker for his constant call for action to aid the people of Illinois. His call and his support of hospitals has given our state a great position as we take on this fight against COVID-19. So as always, please stay home, wear a mask when you are not at home, and keep 6 feet of distance between you and others. Let's continue to keep up our fight against this pandemic. Thank you.